this all started with the observation that we treat patients with fairly similar therapy for head and neck cancer. We treat them with the same radiation dose. For patients who have the same primary tumor or location, the fields are fairly similar. And yet, we see patients with quite a variety or variability in their toxicity, primarily mucositis or their mucosal toxicity. So we thought that it would be very applicable to patient management if we had a tool that could predict which patients would have the most severe toxicity. Scientists at Argonne National Laboratory were developing a very sensitive and portable thermal imaging camera that we thought could be applied to this situation. Mucositis is an inflammatory process. We know that. It should increase the temperature. And so we thought that if we could detect early changes or early increases in the areas of interest, the areas that were being treated of the mucosa, that those would in fact predict patients who had worsening mucositis down the road. If we could do that, we could then alter management, we could provide more supportive care. You can imagine that there would be interventions that could come to play if we had a predictive tool. So what we did was we designed a clinical trial using this thermal imaging tool, where we took patients with either oral cavity or oropharynx, so similar tumor sites, tumor mucosal areas that we could image, and we essentially took pictures of them throughout treatment at around 15 gray intervals of radiation. So each patient had 5 images, one before they started, and then 4 subsequent ones through treatment. And really the endpoint was the difference between that baseline and that first image after 15 gray of radiation. And indeed, what we found was that that early rise in temperature actually did correlate with worsening mucositis at the end of treatment. The correlation was statistically significant, and what it implied was that for even small changes in temperature, you can see changes in mucositis down the road. One of the limitations was that many patients do develop mucositis, and we don't have great assessments for that, and we need to develop that a little bit more. But in general, this may be something that could be promising and could help us with patient management down the road.